Care of the sick, 1900 to 1948. By the end of this double page, you should be able to understand the extent of the improvement in medical care during the early 20th century and understand the key factors affecting these improvements. The early 20th century. At the start of the 20th century, it was still the women in the family who were mainly responsible for treating most illnesses and caring for the sick. Because doctors had to be paid for every visit, people would only use doctors if they were really ill, so most illnesses were treated with patent medicines or preparations bought from a chemist. Traditional folk remedies continued to be used, such as a red cloth to help you recover from cold or influenza, and a sweaty sock tied around the neck to help a sore throat. Minor surgery, such as taking out tonsils, was often done by a doctor on the kitchen table. A general practitioner, a GP, a doctor, might also do some minor surgery in a local cottage hospital, but anything serious would be referred to a specialist consultant in a big hospital. Charitable hospitals. Many hospitals offered only basic care for the sick, rather than the range of treatments we now expect, but some were aimed at specific groups of people. For example, sanatoriums were built to provide a healthy diet, fresh air and hygienic conditions, which patients with tuberculosis needed if they were to recover. Since many hospitals were funded by charity, effective fundraising was vital. In 1912, Queen Alexandra, the mother of King George V, 1910 to 1936, started a National Rose Day on which volunteers sold roses to raise money for hospitals. The first Rose Day collected the equivalent of £2 million in today's money. Increasing the role of government. During the later part of the 19th century, the government had begun to take more responsibility for the public's health. This change of attitude was reinforced when over a third of the men who volunteered to fight in the British Army in the Boer War, 1899 to 1902, were declared unfit and had to be turned away. Since Britain relied on her army and navy to control a large empire, finding ways of improving the health of the working classes became an important issue for the government, and war was therefore a factor in speeding up these changes. There were improvements in how people could access care as well as improvements in the care available, with several key acts, laws being passed by the Liberal government in the period 1905 to 1911. However, there were fewer doctors in the poorer areas. Doctors could choose who to accept as their patients, and they could refuse to give them treatment if the patient could not pay them. In 1919, the Ministry of Health was set up, which gave the government an overview of health care provision in the whole country. This was an important step in the government taking more responsibility for health, but actual provision continued to be a mixture of people paying for private care, local authorities providing some support, and many hospitals relying on funding from charity. The death of 3,000 children from diphtheria in 1938 shocked the government and led to a vaccination program offering free immunization. Now referring to the table here in the top right-hand corner. Improved access to healthcare. By 1900, most cities had built infirmaries or hospitals, fever houses and asylums to care for the poor. There were also local cottage hospitals and specialised sanatoriums, although these depended on charity for their funding. In 1907, health visitors were introduced to visit mothers and to help them care properly for their new babies. This is the government intervening more. In 1911, the National Insurance Act was passed. Working men, their employers and the government all paid into a fund to cover doctors' fees and medical costs if a worker became ill, although it only applied to certain groups of men and did not cover their families. Nonetheless, this act as well also showed the way that laissez-faire was breaking down. The improved standard of medical care on the right-hand side. Nurses were now trained within a hospital, and by 1900, doctors had to have a university medical degree and then be accepted by the General Medical Council. They would have carried out dissections while training and have accompanied a doctor working on the hospital wards. Increasingly, doctors chose to become either a general practitioner who treated the community or a doctor who worked in a hospital, usually specialising in one area of medicine. In 1902, the Midwives Act. Midwives had to be properly trained and registered. This was hoped would lower the rate of infant mortality, the amount of children who died young. And in 1919, after the First World War, the Nursing Act was passed in law, and this set up the General Nursing Council to enforce higher standards of training for nurses. Although the government was taking an increased role in the improving of the health of the nation, by 1939 there was still no national organisation offering the same level of care to everyone. and access to healthcare remained patchy.